I'm Dr. Wendy Gunther, and I'm a pediatric and forensic pathologist practicing in Virginia. I have autopsied too many perfectly healthy, normal, deeply loved infants who died at home because of unsafe beds and unsafe sleep situations. When a child dies at home, we send the medical legal death investigator to the house. The investigator asks the family to help him with a doll scene reenactment, explaining that this will help the doctor determine why the baby died. The person who found the child not breathing is asked to put the doll in as close to that position as possible with a card labeled "Found." Using this simple technique, we have discovered that a heartbreaking number of baby deaths are due to accidental suffocation in unsafe sleep situations. Here are some important safe sleep guidelines that parents should follow in order to prevent the death of their own child. Let's take a look at the first guideline. Always place your baby on his or her back for every sleep time. Babies under 6 weeks old cannot lift their heads out of a smothering surface. You might think they would cry when they're in trouble. None of our parents ever recall the baby crying. They put the child face down to sleep and found a dead baby. Keep your baby on his or her back during sleep time. Always use a firm sleep surface. New babies can die very easily when they suffocate in soft bedclothes or soft mattresses. I have seen babies who died because of soft mattresses on an adult bed, with a sheet stretched tightly over the mattress. Taut is not the same as safe. I have seen babies who died on waterbeds and couches. This is why parents should place their baby on a firm mattress within their crib during sleep time. Keep soft objects or loose bedding out of the crib. This includes pillows, blankets, and bumper pads. I have seen babies who died because of pillows, soft sheepskins underneath them, and soft blankets folded into the crib. A baby's mouth does not have to be covered to suffocate in a soft surface. Just the baby's nose is enough. Many parents do not realize that a baby younger than 4 months old must be able to breathe through its nose when it's sleeping. Please also remember that bumper pads should not be used in cribs, as they have caused several deaths. Little babies can't turn their heads if they roll into a bumper pad that obstructs their breathing. The baby should sleep in the same room as the parents, but not in the same bed. I have seen tragic deaths when the mother or father fell asleep and the child slipped face forward into her breast or into the crook of his arm and suffocated without making a sound. I have seen slightly older babies who can scoot but not crawl die from getting in the corners of couches where they were laid down for a nap, and when they became wedged between the mattress of an adult bed and the wall. And I have seen particularly tragic deaths when the child is laid down between loving parents on an adult bed to share sleep, and someone's arm or knee overlies the baby. A baby's face does not have to be covered for death to come during shared sleep. A knee on the back or an arm over the chest will press down on the baby's diaphragm until it tires out and the baby stops breathing. The baby will not cry, it will just die. Let's review. Place your child face up to sleep. Use a crib with a firm mattress, without bumper pads, without soft blankets, without stuffed animals or pillows in the crib. Do not place a baby on a couch or an adult bed for sleep time. Do not allow the child to sleep with others. It breaks my heart when parents realize that their actions played some role in their child's death. It breaks my heart when the doll scene reenactment shows that a parent lost a child because of a soft folded blanket in the crib, or because a tired mother or father dozed off on the couch while giving a bottle. It would make me so grateful if I never had to do an autopsy like this again. Please, stop these tragedies from occurring.